like this is a problem everywhere, and it's contributing to the burnout. It's contributing to people leaving the profession, and it's contributing to harm on patients. My name is Sarah AWHONN, and I'm located in Los Angeles, California. I think part of the problem is that if we came back and said, I'm going to choose and owned, I'm not going to write their story. I don't know what's going on here. I'm not inserting myself into other people's drama, that like I'm going to give the benefit of the doubt, and I'm going to own that I'm going to show up in a kind way and treat my patients and my coworkers with kindness, giving them the benefit of the doubt, not writing their story. Imagine how that could shift unit culture and technically the world. So the other day on stories there, we did like a this or that thing, and there was like all these polls, and y'all wrote in and were like, what about this or that, epidural, non-epidural, or per diem or part-time? Like it was like, you know, do you give Stadol or fentanyl? And like all these this or that. And one of the questions that came in was, are you feeling burnt out or are you not? And there were, I think, only like 10,000 people that saw the stories that day. About 7,000, it was like 6,000 and change answered that poll. And over 3,000 people said yes. And like, I have been up at night about this because I started bundle birth out of a frustration with the hospital, and a frustration of my impact on the hospital, and seeing everything I'm talking about for the last 15 years, you know, and being frustrated by it and not knowing what to do, but also having some like solutions that like, what if we tried this? And I'm very idealistic, and they wanted nothing to do with me. And I was like, if I'm going to make a difference, like, I think I got to go outside the hospital. So I did, and started with patient education. We still do patient education and childbirth ed. And yet I knew that like, and saw very quickly that if we don't shift the care that patients show up to, they're going to continue dying. They're going to continue having traumatic births. They're going to continue having lifelong impact, and hopefully from a positive way, and that's the opportunity, but from a negative side of things. And so I mean, it started with the physiologic birth class, it's turned into mentorship, and all of our programs have been to combat some of this burnout and create community around the work culture that, I'll say it, to me is so toxic. And not every unit is that way. And so if you are in a work environment, and I can think of one hospital in LA that like my best friend works at, if you are listening, you'll know who you are because I talk very positively about you. But she talks about all the time that like, I'll tell her stories from DMs or from my staff or from my own experience. And she'll be like, I am so confused. Like, what do you mean you don't help each other, or they don't help each other? Like, what do you mean they got yelled at? What do you mean blah, blah, blah? And this to me very much comes down to your manager. So if you are a manager, you have so much opportunity. Like, I'm like tingling how much opportunity you have to shape your unit culture. And if you're a staff nurse, I think you do have some of that, but I would say that like you can only make so much of a difference. And if you have management that's not supportive of these kind of principles, handle your own care. Don't wear yourself out. Myself was there, myself like included. So like there's only so much you can do, and own your own care and show up for every patient and be that example on your unit and take care of yourself. But in general, like this is a problem everywhere, and it's contributing to the burnout. It's contributing to people leaving the profession, and it's contributing to harm on patients, which I know we also don't want. And so to me, it's like, when I say I care, like I am like, I have Google alerts on right now for burnout, and like, you know, and I'm reading the articles coming in, and I'm saying, what do we do about this? We just asked expert that like should not come on the podcast to come on our podcast about burnout. I am planning I don't know when this is going to air, but like we're planning a community call on burnout, because I can't, like, it's like internally, I'm like, I cannot sit around and hear you all suffer. And also know that, mentorship or, community, like all of those things do help. And not writing story and owning your practice and realizing what you can control, letting go of the rest. Some of these other mantras that, like, there is hope and not but, there's hope, and it is going to take some human effort. And it's going to take all of us binding together and saying, enough is enough. This is not okay. How do we hold each other accountable and stand up to the bully with the ones being bullied? I think about back on my units. I'm like, if there would have been 1 or 2 nurses, and actually on my first there was not, but on my second there was. And I actually forgot about this until this very moment. But I had been targeted by a charge nurse so hardcore, where like the assignments, she'd kick me out of rooms when like the patient was hemorrhaging and like, we don't need you here. Who do you think you are? And I'm like, it is my job to be here. I was a peer mentor, so I was supposed to be at every emergency as extra hands. And I'm like, what do you mean? Risking patient safety? And not that I'm all the end all be all, but I was free hands, and everybody was seeing it around me. And I'm not a tattletale. This is probably one of my downsides, but like I tend to be the person who just like grits her teeth and bears it. And like, okay, Sarah, you know who you are. You know who you are. You know who you are. But it was destroying me. And there were 3 nurses that went to management and stood up for me. And let me be clear, nothing became of it. Literally nothing. This charge nurse was not held accountable. There was 0 repercussions. They didn't even ask me about it. But I knew that they went and they stood up for me. And I knew that I wasn't alone and I knew that I wasn't crazy by what I was seeing, where I'm like, I'm just trying to help. What in the world? And that already, I stayed. There were multiple days where like, I can tell you clearly it's like when I'm driving, but I was talking to my mom on the phone and I was like, I'm done. I'm going to quit tonight. I'm done. I cannot do this. I have to go somewhere else. And again, how often we want to quit and we want to leave because of the work environment. And so if you're feeling like you want to leave, if you're feeling burnt out, I want you to assess, is it because you hate labor and birth and you're done and you need something new and like you can't do that part? Or is it because of your work environment? Or is it because there's so much else going on in your own personal life that you're bringing into it? Or is it because you are at the bedside and you're having a hard time setting it aside and leaving work at work? Because that is a skill that like takes active intent and work. And so I think, if we're honest, that very, very often it's because of our work environments that are the contributing factor, if we are like being truly honest. Now, mind you, there are other things, so like that's not it, but it's going to amplify everything else. And so like you say, like I say it all together, it's because I stay up at night because I want so much better, and I just believe that there's so much better. I see so much hope in obstetrics, in labor and delivery in particular. I know like we're perinatal. I've only ever been in labor and delivery. So that's my only vantage point. I've floated to postpartum a bunch of times, but like, that's not my world, and so I can speak to L&D that like, there's so much potential, and there's so much potential in the community that we can build and how we show up for each other and how we feel supported. We can do hard, emotional, physical work and love it for 30 years. I really believe that's possible. And yet there's a few barriers going on. One of them, I will say, is staffing. So when you're saying that in your head, I'm very aware. I cannot change your staffing. I can talk about it and I will. But, it's like, but there's other things that we can own ourselves rather than blaming everybody else, to say, I'm feeling burnt out. I'm feeling unenergized. I'm feeling disconnected. I'm feeling sort of apathetic towards work. And then say, all right, what can I do about it? And sometimes for me, a lot of times I will say that that's been community and finding those people who get it, finding those people that can support you. Sometimes it's doing less, but sometimes it's actually actively doing something more. And I know when we're tired, that feels like, oh, I can't do one more thing. But sometimes it's just about where you're expending your energy. And so it's because I care so much that like I work every weekend and every evening because I'm like, I have so much hope and so much like I believe so deeply in the world of OB. And I'm going to say all birth professionals, but labor and delivery nurses are obviously like, it's my jam. When I think about OB and burnout's hot, so I've mentioned burnout a couple of times. I think just an awareness of where we're at as a profession, I think is really important. And I do feel very privileged that I feel like I have a very strong vantage point on how people are doing, one through our mentorship program, through even Instagram DMs. Like I'm in DMs all the time and reading your stories and talking to you about it. I voiced a girl last night who just said, I am struggling, all caps, that like I'm really struggling to make it in this. And yet I love birth, but I am struggling. And so one, if you're feeling that way, I want you to know that like we care. AWHONN cares, Bundle Birth cares. There are people, I assume on your unit, I don't know your unit, I'm not writing your story, but like there are people out there that care and that get it and that know that and recognize that your job is unique, it is beautiful, it is such a privilege, and it's really, really challenging. And there's multifactorial reasons for that. I think if you're wondering if you're burnt out, what we know statistically is that 1/3 of OB nurses would meet criteria for at least 2 out of 3 burnout dimensions. This is burnout syndrome. So like burnout is one thing, and then there's burnout syndrome that's diagnosable. Those 3 criteria are emotional exhaustion, depersonalization, which is cynicism. And actually, I was just at a leadership conference, and it was Andrew Huberman actually that spoke. He was one of the people, and he talked about how when you hit cynicism, which is like a detachment or like a negativity about your work, it's like that is like a red flag, like bright light, like hello, wake up, because cynicism you cannot work with. Everything, then there's like nowhere to go from that. And so if you're finding yourself being more cynical, if you're finding yourself like depersonalizing away from your patients where you're just like apathetic, I don't care, I can't care. That one for me has been a huge indicator. I can't care. Because of your capacity, that would be a depersonalization, and then a diminished sense of personal accomplishment in your work, where you're just like walking away and it used to feel so fulfilling and now it doesn't feel very fulfilling. Those are the criteria for burnout syndrome. And so I think we have, I want to call it like a epidemic. Can I say that? I don't know. This is like my own assessment. Do not quote me from like studies or whatever, but I know that like this is a problem. And so if you're feeling that way, I want you to know that like there are things you can do. I can give a couple of suggestions by research. And also the first one is you've got to find your community, and that community within work and OB. So you have people that you can talk to that like get it. It's so different when you're like, yeah, and then the decel happened and, you know, we moved to the back and then this doctor, blah, blah, blah. Like your family members can have compassion on that. But like the decel happened, like that's stressful. And like or we crashed her last night, or like we gave what was like 200 units of blood. Like somebody like me as a nurse, I'm like, what? I've never heard of 200 units of blood in my life. Whereas you're like, is that normal? If you don't know, versus like, we gave a unit and you're like, okay, cool. Nice little unit of blood. Like, whereas somebody else could be like, oh my God, you gave blood. Like, and it's just, we get it differently. And so finding that community within OB and outside of OB. And one of the key things is that your ability to detach from your work outside of work. And so creating some active recovery responses. And this is active recovery. How many of you, and you're going to hear me say this on every platform, because like this is a start of something that like we've got to tackle this burnout thing. Like we've got to address it. In fact, our mentorship program coming up for January, again, I don't know when this comes out, we are targeting and looking for burnt out people who want to restart their flame and who need a battery in that battery pack to keep going. And so we're going to talk even deeper about this in the coming times. But this concept and notion of active recovery, it's what we do for working out. If you're trying to like train for a marathon, like you have to have days off. You have to, or your body will fall apart. And so how often are we thinking about an active recovery from work? Work is a workout. It's a workout for your emotions, your brain, all of that. And so it's like what you do during your free time, but also what you're thinking about during your free time contributes to your ability to recover and then therefore show up back at work to feel like you have anything else to give. And so that may mean boundaries. That may mean, and it does mean sleep and better sleep hygiene, which I am the worst at. I love a late night TikTok scroll. And it also means exercise. And by exercise, I think we're all tired of hearing about exercise. There's so many programs or whatever, but what's helped me in that is that you actually have to metabolize the stress hormones. You're actively like working them out of your body. And so this doesn't mean you're going to like an Orange Theory HIIT class, spin, blah, blah, blah. In fact, for me in my exercise journey, I actually had to give up the high stress exercise and go to a lot more like down regulating exercises, which for me is Pilates, that like it's a lot slower, it's a lot better for my nervous system. But I had to discover that as I metabolize those hormones, going for a walk outside, being in nature, getting sunlight, especially if you're night shift, you know, that like after your shift, do a lap around the block, that like you're actively metabolizing those stress hormones. It will help you in the long run, because we also know that there's something called an allostatic load. And this really is like the cumulative effect of life stressors on the physical body. It's like a whole other thing that you can get into, but there's certain things that increase your allostatic load, and then there's other things that decrease your allostatic load. Green space, sleep, connection, even like religious affiliation, finding meaning in your work. All of those things actually not only you think allostatic load is like your stress, but we're talking about this particularly having impact on your like physical sickness, like the body getting sick because of the stress. And so, it's my little tangent on exercise, but doing something to move your body. And then the other one is just having compassion on yourself and giving yourself that same grace that I'm asking you to give others, and not writing their story. Don't write your own, or write your own, right? That instead of going all over the place, that we get to actively choose how we treat ourselves and how we see our mistakes, how we see the decisions that we made clinically that day, how we see the fact that I was yelled at by a physician because I wouldn't up the pit after 300 plus MVUs in tachysystole, you know, and I can choose to see that like, oh my gosh, like he hates me, or, oh, like I'm going to get in trouble, and like, oh, this is bad, and maybe I should have this, and maybe this, and what if I this, and what if I that, versus seeing it and going, no, I did the right thing. I did what was necessary. I followed my policies and procedures. And that's it. The fact that that doctor yelled at this nurse, you know, and like verbally abused her to the point where I got a whole long DM about it and like asking for help, that's their problem. And like how embarrassing for those that show up to the world being that critical, or you know, being verbally abusive, putting each other down. I'm sorry, that's embarrassing, and that says a lot more about the other person than it does about you. And so it's sort of that idea of like actively having compassion. This isn't empathy. That actually we know that self-compassion actually has a greater effect than empathy. Our empathy trainings aren't really working. And mind you, self-compassion is treating oneself with kindness. And then realizing that like you're a human, that you're not perfect, and then being mindfully aware of your suffering, or of the hard, or of your challenges. And so it's saying that was hard. That situation with the doctor, going home, going on your walk and saying, that was really hard. And kind of mulling it out, talking it out with a friend, sending us a DM, or kind of getting it out in that way. And then coming back to, I did the best I could with the knowledge and information I had at the time. I did the right thing. I cared for this patient. Were you intentionally doing anything wrong? No. And if you were, then be accountable to that. Fine. But most of the time, the majority of you are just trying to do the right thing. And unfortunately, in the current work environment, that's not always rewarded. I don't believe that we have a solution, but I think we have support. And I think that there are, it feels very hopeless a lot of times, and it's not. It's not hopeless. And there are so many people, I think about Carly, one of our mentors, who joined our mentorship program because she was like, I'm going to have to leave this profession. And by the end, now she's a mentor. And mentorship, she would say, saved her. And what is mentorship? It's getting the right education, getting encouragement, getting validation for the way that you practice, and then also having that community of like-minded people that maybe aren't your unit. That you can get outside of that. So that's what AWHONN does. That's what Bundlebirth does. That there's environments in which you can invest yourself. You have to be picky with that. Not everybody gets your energy. Not everybody deserves your energy, but finding those communities where that you're going to be embraced even when you make mistakes. And even when you're being hard on yourself, that you can have other people around you supporting you and reminding you that you did the best you could with the knowledge and information you had at the time. One of my favorite phrases from mentorship that I used when I was new was, I'm not stupid, I'm just learning. And that was a mantra, right? That I had that when, people talk to you when you're new, you're dumb and you're like, I didn't know because I've literally never done this before. I am new. I am trying. Trust me. I'm going home and reading AWHONN's perinatal nursing book every single night. I don't know what else to do other than I need the experience. And so please hold some space for me. Don't write my story. I'm not stupid. I'm just learning. And I had to tell myself that when I was early on and still, I think that about business now. I'm I'm not stupid. I don't think. Sometimes I question that. But I'm learning and I don't know. I don't know. And, you try and it's not perfect. And people will criticize always. But if you know who you are and you remember who you are, and that is the work, that is always that grounding place to come back to, because the world's always going to have a million opinions. And if you're constantly looking for that validation from the outside world, you lose yourself. And so it's creating that protective shell of this is who I am, and growing to know who you are, and growing to be better, and grow in the areas that you want to grow in, and heal your traumas, and, and create that protective layer that, yes, some people are allowed into, but also you've set those boundaries so that when the world criticizes, and when they write your story, and when they are mean, and when they misinterpret your actions, that you can come back to you and say, I'm going to let that bounce, instead of it becoming your everything and destroying you.